There is a quiet storm moving through American healthcare right now, and most people haven't even heard a word about it. This week, the US government postponed the meeting with the US Preventive Services Task Force for the third consecutive time. That may sound like bureaucratic noise, but this panel determines something critically important: what preventative healthcare Americans receive and what insurance must cover at no cost. Cancer screenings, HIV preventative medications, early detection diagnostics, preventative medications that actually stop disease before it begins. And for decades, this task force has been one of the pillars of modern medicine. It answers a simple question: what care keeps people from getting sick in the first place? Now, more than 100 healthcare organizations are sounding the alarm, because when those meetings stop, the entire preventative care system begins to stall. Screening guidelines freeze, insurance coverages becomes uncertain, and clinicians lose clarity about what patients should receive. And when prevention slows down, disease speeds up. This is not theoretical. Preventative medicine is the reason cancers are caught early. It's why heart disease risk is reduced. It's why infections are stopped before they spread. When prevention disappears, healthcare becomes crisis management, and clinicians are forced to treat disease that never had to exist. Frontline healthcare clinicians and professionals understand something policymakers often forget. The most powerful medicine in the world is not treatment, it is prevention. Catch a disease early, survival increases. Prevent a disease entirely, suffering disappears. That is why preventative guidelines exist, not to control clinicians, but to protect patients. Without clear preventative guidance, healthcare professionals are left navigating uncertainty. Should screenings change? Will insurance still cover them? Are patients going to delay care because coverage disappears? When preventative policy becomes unstable, clinicians are forced to make decisions in the fog. And medicine should never operate in the dark. Healthcare professionals do not fear scientific debate. Science evolves, evidence changes. That is how medicine improves. But prevention must remain grounded in evidence, not politics, not delays, and surely not silence. Because prevention isn't a policy discussion. It's a patient safety issue. This is where the public needs to pay attention. Prevention healthcare is one of the most powerful tools our system has ever created. It saves lives quietly. It reduces suffering before it begins, and it protects millions of patients every single year. But systems that protect people only work when they remain stable, transparent, and evidence-driven. The moment prevention becomes uncertain, patients lose protection, clinicians lose guidance, and disease gains ground. The question isn't political. The question is simple: what happens to a healthcare system when prevention disappears? Because once disease begins, no treatment in the world is as powerful as stopping it before it begins to start. And that is a conversation every healthcare professional and every patient deserves to be a part of.